Keep your mask on.
Imagine cleaner, safer public spaces and neighborhoods, no traffic jams, and having this much room on the bus or train platform. Imagine access to money and medical care at your fingertips, and learning without leaving your home. Imagine a job in the global economy, working from just about anywhere in Africa. As cities around the world look at ways to bounce back from COVID-19, could this be an opportunity for Africa to leap ahead? In the next half hour, we'll speak to Africans who are using technology we already have to help shape a future that's already here. Hello and welcome to Our Voices. I'm Heidi Adams Fitzpatrick. There's a lot of talk these days about what life will be like after COVID-19, how we'll get back to normal or get used to a new normal. Well, this week we take you forward in time to the next normal, and we begin with Africa's urban future. How will COVID-19 reshape cities across the continent? I asked an urban planner about it. Astrid Haas is with the International Growth Centre. She says COVID-19 is an opportunity to rethink the way Africa's cities are designed, built and managed to prevent future pandemics.
The major opportunity that we have is that Africa is really still at the beginning, at the infancy of its urbanization. 2/3 of our cities are yet to be built. The window of opportunity we have is relatively short, so it's predicted in the next 20 to 30 years these cities will come. But it means that we still have the opportunity to get them right. And I think what this pandemic has shown us, not only in Africa, but across the world, is density sort of enables contagion. Evidence shows that it's 3 times more expensive to retrofit a city where people have already settled than to get it right from the start. So really, let's seize the opportunity. Let's ensure that we get those 2/3 of cities correct, but obviously not forgetting that the cities that we have and ensuring that they can become more resilient to future pandemics and other crises. We've got to understand the power of water and sewerage infrastructure. These are perhaps not the sexiest things to talk about. There's a lot of sort of hype around things like smart cities and everything else, but really we need to get the basics right. And water and sewerage infrastructure is really key in terms of making our cities function and managing these downsides of contagion. In the early 19th century, New York was ravaged by waterborne diseases, by cholera and everything else. And it was the understanding that these diseases were transmitted by water that really helped the city lobby to be able to get the finances to put the infrastructure in place. So by the early 20th century, all cities and local governments in the US were spending more on clean water than the whole federal government was spending in their total budget without the army, not taking into account the army and the postal service. But the high investment has a high payoff too, because it is the foundation of making the city function.
Well, I asked Haas to walk me through a day in a well-designed, well-run city. What does it look and feel like?
So I really like this question, and I sort of imagined it for myself and myself and my daughter, right? And what is it that we would love to see from a city? So I think, waking up in the morning, you're in a house that is affordable, that is clean, that is safe, but where you also know you have some ownership over the house, the property, either through an ownership contract or through a rental contract, such that you are assured that tomorrow no one is going to come and bulldoze it down, right? And I think that sense of security is really important as a very fundamental way that you can get up and you can be invested in your city. No one likes to talk about this, but we've got to take out our rubbish somewhere. And, when you take your rubbish out to the street, you want to ensure that it's collected. You want to ensure that it's disposed of in a way that is sustainable. And then schooling, I think, if I think about my own daughter, when she gets to schooling age, you want to be able to get them to school somewhere that is relatively close to your residence. So whether it be a walk or bike ride away or just a short public transport trip, but where you can ensure that they have affordable schooling and that it is of good quality. After you've dropped your kids at school, you want to be able to get to work. And here I think public transportation is really important because public transportation allows us to move large volumes of people at a low cost, if planned and built correctly. Then I think when you pick your children up from school, you want to be able to take them to somewhere where they can enjoy public space. And I think this is really critical. And then I think finally and importantly that when you get home, that you sit down and you pay your property taxes and your other taxes, because you have a good understanding that none of these services can come for free. Not only implementing them, but maintaining them over time, understanding what you want from your city, but also contributing and giving back to your city.
Well, that was Astrid Haas from the International Growth Center speaking to me from Kampala, Uganda. Now, COVID-19 has also made us rethink the way we travel. Take a look at this. In Soweto, South Africa, walk-through sanitizing booths spray bus commuters every day. In Nairobi, everything from train cars to sidewalks get the fog. While scientists are not sure about the effectiveness of the mass disinfecting we're seeing in African cities, some commuters say if nothing else, it gives them peace of mind. Could cold, hard cash be on the way out? With fears that handling money could help spread the coronavirus, many are banking on the cashless economy. Now, we know Kenya has been at the forefront of the continent's mobile money revolution, but now other African countries are getting a second chance to get in the game. Oriani Tangishaka has more.
Haiti, Africa's mobile money market seems to be cashing in during this COVID-19. In Nigeria, people are betting on digital currency as a safer and faster way to do business. Timothy Obwezu takes a closer look.
Cashless payments only reads the sign at a laundry shop in Abuja. It's a recent measure to limit physical contact with cash to prevent the spread of COVID-19, says store manager Paul Godia.
Different people that come from different places, and that money is a general accepted, which is coming from different people and is circulating from different angles. It may be Mr. A have this disease, or Mr. B have this disease. So in the process of circulating this money, maybe Mr. A has this disease, so it can definitely come to me and will affect me.
With more businesses in Nigeria using the payment technology to ensure health and safety during the coronavirus pandemic, the mobile money industry is experiencing significant growth. A report by the Nigeria Interbank Settlement Scheme, NIBSS, says mobile money transactions grew by 14.5% between February and March, a period when the virus was first reported in Nigeria. The trend has continued to increase, say mobile money agents like Isaac Oda, whose business is booming.
We are rendering essential services. So our services is not something you can do without. Because people transact money, people pay for one or two things. People buy things every day, and then you need money to carry out that transaction. So that is why our services is booming in this pandemic.
As Africa's largest nation, Nigeria is a huge market for mobile money and financial technology operators. But for many years, restrictive government regulatory policies limited investment in this sector. In 2018, Nigeria's central bank relaxed the restrictions with the aim of having 80% of Nigerian adults use mobile money by 2020. Financial technology expert Raphael Inusa says the pandemic could fast-track this goal.
There has been a steady growth of increase in the fintech sector, and foreign investments, even way before the coronavirus hit Nigeria, the fintech sector has attracted a whole lot of foreign investment, from Visa investing in InterSwitch to Flutterwave to several other fintech companies. But the coronavirus pandemic has accelerated a whole lot, especially in the fintech space, because we now have increased transaction online.
The expansion of Nigeria's internet penetration is also enabling the mobile money industry to thrive in the West African nation. Timothy Obiezu for VOA News, Abuja.
Well, you can also use your phone to connect with us on social media. Our handle is @VOA Our Voices. Tell us how you think COVID-19 will shape the future of your community, your city, and your country. You can also drop us a message on WhatsApp. That number is right there on your screen. We're going to take a short break, and when we come back, should Africa's universities go virtual? We'll look at life as an online student. Also, what are the tech jobs of the future on the continent. We'll speak to an expert who says it's all in the cloud. Back in a moment. Is about more than just sitting here and talking about women's issues. It's about listening to them
and bringing their opinions to the table and making sure their voices are heard.
Because our lived experiences, our stories, and our voices will help shape the next generation.
You're with Our Voices. Welcome back. We're talking about a post-COVID future, and we turn our focus now to education. Experts say around the world, universities are going online at a scale never seen before because of this pandemic. So we wanted to find out what it is like for students who have had to move their learning from a lecture hall to a laptop. We asked Maud Cora to find out for us, and she spoke to Ajamang Okiere Darko. He's a student with the University of Professional Studies, Accra, Ghana. Darko says online learning has given him a glimpse into the future of tertiary education on the continent.
Hi, Ajuman. How are you?
Hi, Maud. I'm doing good by God's grace, and you?
I'm awesome. So, let's just cut to the chase, okay? What's your new classroom like? Can you show us around?
I have two areas that I do my studies. I have a personal study right here, so you can see my desk, and then my chair right here. So I sit for my personal study right here. So each day I have myself seated right here with my stuff, my books will arranged down here too. So you can see them. The central point where I do most of my video calls. So take you to where I do my video calls. So over here, that's my laptop. Each day for my classes, I have my Wi-Fi connected, my laptop on, and then we start learning as usual.
What are the challenges having to study online from your perspective?
Even though we had to adapt to online learning, we had no choice. It's quite a frustrating issue. Nobody caused this, but we had to try and keep this going on. Education had to go on. And the investment made by each student to get enough data, a device to keep up with learning was something we deliberately decided to do to keep up the movement. We want to prove the fact that learning can take place anywhere. So the challenge here wasn't really a challenge to us. It was an opportunity for us. The students, believe me, did not rise against the option of online learning. We actually embraced it, that we want to use this avenue to explore because we are in the 21st century and we have to do things likewise.
Do you expect that things will, some degree of normalcy will resume into the system? I mean, and if you do, what do you think the new normal will be like?
One of the issues we have in Africa in our education system is the access, providing more access, people to learn at their convenient spots. At the graduate school, we have so many workers. How can we have workers learning without stress? So this system has now opened a new way whereby I believe that in the next 2 years or 5 years to come, every particular course we study online or on campus would have an online component to it. So now your lecture hall will be your laptop or your data. Limitless number of people can learn.
Thank you very much, Ajuman. Thank you for joining us. It's been a pleasure talking to you, and I look forward to talking to you soon.
I appreciate the opportunity.
Maud Cora there for us. Maud, thank you very much. So tell us, what do you think? Should Africa's universities go completely virtual, or do you think a blend of in-person and online learning is the way to go? Tell us on social media. We would love to hear from you. COVID-19 has exacerbated unemployment problems in countries worldwide. In Africa, the tech industry appears to have opened doors for many during this pandemic. So what are the tech jobs of the future on the continent? We put this question and a few others to Michael Berhane. He's the CEO of People of Color in Tech. He says COVID-19 hasn't really created any new trends in the tech job market. Instead, he says it has accelerated existing ones.
Remote work was something that was quite nascent within the tech industry. It did exist, but now it's going to be a much bigger push. Companies like Twitter and Facebook are pushing remote work. And I feel like the way that China benefited from globalization with manufacturing earlier, I feel like the African continent and the talent within the continent can benefit from this trend. You can conceivably be a Facebook engineer based in Lagos, based in Nairobi, based in Johannesburg, and that is definitely the future and a massive opportunity for us. So the top 3 tech jobs of the future, I would say definitely all fall within like the engineering world. I would say AI, machine learning, engineering also represents a great opportunity, and then information security. And then one fourth one, perhaps, I would say things related to the human cloud as it's subbed, which is essentially data entry, data labeling, data annotation. I think it represents a great opportunity for the African continent in terms of like outsourced work from the West. Keep an eye on payments and cryptocurrency in general. I feel like a lot of the existing infrastructure that we have in the West means that we are not necessarily the best use case for these technologies. And I feel like in the continent, we can almost leapfrog a lot of the existing infrastructure and go direct to kind of cryptocurrency, mobile payments. So the future of currency is something that I think is massive. Reach out to hiring managers, meet your peers, and produce content and share content. The other thing as well is do side projects. So if you are an engineer, for example, or an aspiring one, produce a little app and then write a blog post explaining what you've done, what you've learned, and how it's helped you in your career. And then the other thing I would say is subscribe and listen to a lot of the free content out there. We have so many email newsletters and podcasts from individuals who are established in their career, and they're giving away information that was once reserved to expensive books. You can listen to billionaires in tech, you can listen to software engineers in tech talk about their day, their career, their experience. And then the final tip I would say is learn how to interview. There is a science and an art to it. Oftentimes in tech jobs, you're often asked questions that may not relate to your day job. So you need to know, for example, about an algorithm that maybe is not necessarily relevant to your day-to-day, but may be asked. So there's content online about that as well. So learn how to interview. I see a lot of people trip up on that last part, even though they're fully qualified. Be adaptable and flexible. The industry is fast moving. You're going to have to learn new things. You're going to have to constantly adapt. So don't be afraid of change.
Michael Berhane is the CEO of People of Color in Tech. And if you liked what you heard, you can also listen to Berhane's weekly podcast, Techish, for more tips. Still ahead, here on Our Voices, we look at what's next in healthcare and what a visit to the doctor could look like in the near future. Also, with movie theatres shut, a blast from the past could help reinvent the future of the film industry. We'll be right back.
Voice of America, upholding our mission.
We at the Voice of America are taking COVID-19 very seriously. And for that reason, we're bringing you Africa 54 live from Esther's house.
Today and every day, we're here for you. We improvise in tough times, but we report from our closets, from our laptops, from our homes, as we take care of our kids. Our homes are the new newsroom. We're all home together, but the news is still here. Voice of America, a voice for the world. Because a free press always matters.
Welcome back. As the coronavirus continues to spread around the world, are you worried about going to the hospital out of fear you may be infected there? Well, there's a global movement towards something safer, home-based healthcare, and experts say it has the potential to really take off in Africa. Ayen Biyo takes a look.
In Kenya, Dr. Muthoni Karanja is packing her bags and heading out to where her patients are. A doctor making house calls is nothing new, but it can be hard to find medical care when and where you need it. Kenyan startup Tibu Health created this app that helps you locate the nearest available doctor or clinician. They show up at your house, medical kit in hand.
Normally, I never go to the hospital because it takes too much time. But this time, I didn't hesitate. I was like, oh, this is easy. I just call a doctor and it comes 15 minutes. They took the blood test and they sent the blood to the lab and it went well. Yes, it took just 30 minutes. Normally, I spend the whole morning in the hospital.
At around $9 for a consultation, ordering a doctor on Tebu is probably not for everyone. The company hopes to expand its service to other countries on the continent.
Hello, good morning. I am here to take your temperature.
This hospital in Rwanda has 3 new staff members to help minimize contact between medical workers and patients infected with the coronavirus. The robots are not meant to replace human hospital staff. They simply monitor patients, take their temperature, and relay important information to medical teams, cutting down the number of bedside visits doctors and nurses have to make. In Ghana, it's not just drone delivery of medical supplies that are taking off. To meet social distancing requirements and the shortage of medical facilities, some doctors are switching to telemedicine. They can see patients via video chat, no matter where they are.
When the pandemic started, I noticed that most of the people were scared to come to the clinics and the hospitals because they thought that they were going to get the infection from there.
This healthcare platform is provided by Telemedicine, a company set up by a Ghanaian doctor living in the U.S.
I think it's going to be an eye-opener to show Ghanaians and Africans especially that there's less stressful ways of doing things, right? Because to get a lot of things done in Ghana and Africa is really, really hard because a lot of our systems are just kept manual. We need to leverage technology to do some things.
So is telemedicine the best fit for African communities and countries? I asked someone who has had first-hand experience rolling out the technology in rural Zimbabwe. Yaya Mbawa is the CEO of the Mbawa Group. He says Africa is the perfect place for implementing and expanding telemedicine.
Africa is in a unique position where we have to build the healthcare systems from scratch. And the way I look at the digital health strategy for Africa is going to be a combination of not just telemedicine, but also artificial intelligence. Because telemedicine provides access to care. With artificial intelligence, we can actually enhance the doctor's capacity to better diagnose patients, right? And we can also leverage technologies like blockchain to provide a better data management for patient medical records. Because one of the problems in the African healthcare system is that it's so fragmented. When the patient goes from a doctor to another doctor, the history is lost. So it really makes it difficult for doctors to do a proper diagnosis. So being able to provide a platform that will track the patient's medical history and make it available to the next doctor to provide a better diagnosis. I think we also notice some skepticism in the patients' population. Well, the messaging for those people at the very basic level for the underserved populations in the rural areas is that you are currently unable to have access to quality care where you are, so you have to travel long distances, hundreds of kilometers to see a doctor to treat you. But now with telemedicine, you don't have to travel. You can stay right where you are in your village and just walk over to your local health clinic and have access to a trained, experienced physician. I think that, there's absolutely no doubt that telemedicine is here to stay in Africa, right? It's going to play a big role in strengthening Africa's health systems.
Yaya Mbawa, CEO of the Mbawa Group, speaking to me from the US state of Maryland. Well, now here is something that is bound to make anyone smile. Congolese designer Hanifa Mwemba was ready to debut her clothing line, Hanifa, at this year's New York Fashion Week. When her show got cancelled due to the pandemic, she came up with something very futuristic. Mwemba created a virtual fashion show and streamed it via Instagram Live. She turned each of her garments into a 3D image using the body of an avatar. Tens of thousands of people watched the event. Mwemba says she's used 3D animation in the past to design her pieces and to do remote photo shoots. But this showing was much trickier.
We had to make sure that it matched the realistic garment. Like, we had a really hard time making sure like a dress flowed like naturally and how it would flow if a curvy woman was wearing it. We had to make sure that it fit everything the right way. We said, everyone is home, everyone's on their phones, let's get this done. Let's put this show out and let's just do it.
I love this. What a savvy woman. We wish her all the best. And finally, something from the past could become a fixture of the future. Now, if you've been around long enough, you might be familiar with this scene. Yes, the DriveIn, making a perfect comeback in Abuja, Nigeria. Cinema closures and stay-at-home restrictions have been financially catastrophic for the Nollywood film industry. As restrictions on movement ease, industry experts hope that bringing back the drive-in could reinvent the film scene and give audiences a chance to get out and socialize while keeping their social distance. If masks are going to be part of our future, we might as well flaunt them, right? Well, we leave you with an amazing array of masks seen about town across Africa. We'll see you next time. Goodbye.